As we give everybody a minute to enter into the room from the waiting room, I wanted to say welcome to today's webinar. Currently, all the lines have been muted, but you will be given an opportunity to ask questions. You can also ask questions in the chat. We do have live transcription available, so if you need that, there's a button at the bottom. And today's webinar is being recorded, so if you have objections, you can disconnect. We will send the recording out with the slides shortly after. It takes a little bit for Zoom to process the recording, but we will send it out. At this point, I will turn it over to Chad to begin the webinar. Thank you.
Thank you, Tristan. Welcome to our 6th KnowledgeWorks webinar, Enhanced Child Support Services for Non-Custodial Parents Seeking Employment. As everyone's aware, most of our states now operate some type of non-custodial parent employment services programs. However, did you know it's been, almost, what is it, like 30 years since Perora? And while Perora was one of our greatest strengths, greatest advancements, made our program more powerful, it's like kind of the same effect for many of us. Sometimes our greatest strength can also become our greatest weakness. And many times our automated way of handling our child support enforcement cases and processing our casework can become a barrier to our overall end goal of achieving support and gaining support for those children. So many states have begun to not only offer the non-custodial parent employment services, but many of them have started to enhance their child support services and applying the practice that not one size fits all, and that you have to customize your use of these enforcement remedies based on whatever barriers you're trying to help someone overcome. I'm going to turn it over to 3 states who have begun to do just that. We're going to start off with the state of Michigan, followed by the state of Vermont, and then we'll close with the state of Wyoming, and we'll leave some time for questions and answers afterwards. I'll allow each of our presenters to introduce themselves, but please listen for how they've customized their use of enforcement remedies, strategies to enhance people's ability to pay their child support. Let me turn it over to the state of Michigan. Thank you for joining us today.
Chad, can I interrupt? North Dakota is on here, and I'm now wondering why.
Maybe you registered to attend, or you can send me a chat maybe offline so we can turn this over and let Michigan get started.
Sounds good.
Good afternoon, everyone. Thanks, Chad. I'm Erin Frisch. I am the Title 40 Child Support Director for the state of Michigan. And I think, if I can't see slides, but if you're at that intro LEAP slide, that would be great. Yes, so I'm just going to tell you a little bit about what LEAP is. LEAP stands for Learn, Earn, and Provide. It is our 1115 waiver demonstration project in 5, soon to be 6 counties in Michigan, focused on child support payers who are unemployed or underemployed. We partner with our State Department of Labor and Economic Opportunity, our workforce development area, and then our local, what we call our Michigan Works, which are our workforce development agencies that are regionally across the state. And a couple of things to highlight about LEAP. This is a program that is voluntary, but you can also be court ordered to participate. They must live in one of our pilot counties. If they have to pass a drug screening as requested by employers and be medically able to work. And employment services that we provide include job referrals, training opportunities, GED completion, community service so that they can learn some skills, workshops covering employability skills, transportation and supplies needed for employment, like tools or equipment, and retention services to help employees stay employed once they receive a job. LEAP also provides subsidized employment opportunities that are funded through the Michigan Works agencies themselves. So that's a little bit about LEAP, and I'm going to turn it over to Paul, who's going to get into some of the details.
All right, thanks, Erin. So I'm Paul Game. I'm on the court side here in Michigan with the Friend of the Court Bureau. And when we joined talks with Erin's shop about this pilot, one of the things that came up was discussing a recognition that payers on this pilot would likely need support modified. I mean, right, that's part of why they're seeking employment, and that this modification of their order could be done as really a service or an incentive for joining the pilot. The question really became, how do we do that? I think there was a desire to prioritize cases in review and modification specifically. One of the thoughts was have them jump to the top of a queue to make sure that we prioritize them and get them done first. There was also discussion about the fact that maybe it's really the relief back to when providing effective relief back to when the parents entered the pilot that was important. And I think this raised a couple of important questions for us and options. But I think one of the important lessons we learned is to first identify your goal or purpose so that it informs those options you have for getting there. If the goal recognizes that parents in this pilot likely need support modified, and we are aware of the rules that apply to that process, it helps us understand that it's not just the act of the review and modification that's paramount, it's the need to provide effective relief as early as possible. And this applies to many situations, like when COVID struck. It also helps us balance and protect against potential concerns that individual options may bring, like is it fair to prioritize cases over others? But I just mentioned that there are rules that apply, so let's quickly refresh those on the next slide. And this is going to be a crash course on the BARDA retroactive modification. So the rule, which is cited on the slide there, essentially says that orders cannot be retroactively modified except for when there is a pending petition for modification with notice provided. Michigan law has a similar provision that we've codified. And so in Michigan, our orders are issued and controlled by the courts. So a petition pending must be before the court in order to allow us to have a potential earlier effective date. And this leads to another important distinction. While we may be a judicial state for our orders here in Michigan, I think a lot of these concepts can apply and play out in your own states and jurisdictions. Just think through kind of how that might look different or similar given your own rules and process. And I think that brings us back to our purpose or goal of seeking the relief. Another important thing that we need to understand is the difference in the possible earliest effective date. If a petition is pending and served, the earliest effective date is the date of notice for that petition. So a classic example here for us is a party files a motion with the court asking for a review of their support order. On the other hand, if a petition is not pending, then the earliest effective date is when that support recommendation is provided to the parties and filed with the court. This is the back end of the process after we've sent the questionnaires, collected the parties' information, run the calculation, and then send it out. A classic example here is our 3-year reviews, or when a party requests a review at the office, but nothing gets filed with the court at that time. And in those cases, we know that we have 180 days to complete the review, and there are those processes that come into play with that approach. Another thing to just kind of keep in mind that we've seen, the name of the form at the local office doesn't necessarily matter. We've seen some offices call it a petition or a motion to the friend of the court or local office requesting a review. But just because it's named that, right, it doesn't pull in the statutory process of allowing us to preserve that effective date. If we go to the next slide. So with these rules in mind and with kind of the goals in place, it allowed us to explore what options we have that we can use to meet the varying needs of the parents and the staff doing the work. Right. So we know that in order to continue to serve families effectively, we need to use our own, often limited, resources wisely. And by recognizing that the goal was really more focused on the actual date relief can be given, it helped us understand how to better process the case and craft the order. It gave us a couple of options. The first was really the party or the friend of the court on its own initiative, and that's key, may file a motion. As we heard just before, right, that motion serves as the petition pending and preserves the earliest possible effective date. And the key here for us is that our friend of the court staff are able to file a motion on their own initiative if a party has not filed. So knowing that this approach is particularly useful when the primary purpose or impetus for the review is getting relief to the party at the soonest possible time. Another approach we have with our court orders is the use of temporary orders. And these are really useful when the amount or the duration of the change is uncertain. And I can see that applying to this pilot, the parents on this pilot, right? We don't have employment. We don't know when they're going to get employment. And so preserving the date, but allowing for flexibility for the court and the parents is important. A thing to keep in mind here with temporary orders, don't forget to circle back and convert those to final orders once kind of the situation has become clear. Another approach is using multiple grid orders. So these are orders that contain multiple support grids within the same singular order, or amounts that take effect at different points in time. So for example, if we know someone works seasonal jobs, you can use a multi-grid order to change the grids being used at a given time of year or employer. And so the benefit that this brings is it avoids the need for us to circle back and review and modify the case every single time there's a change in employment. These work best when there are future known conditions as opposed to the temporary orders when we don't know what's going to happen in the future. And again, I can see this being useful in our pilot demographics where we have parents who are working through the program, and as they get closer toward completion, right, and their future work may become clearer or better known, we could use a multiple grid to set up the kind of the exit from the program and help the order just kind of naturally take shape there. The benefit here is, right, we're not going to be able to do this in all of our cases, but we do know that if we're able to do it on some of the cases, it's going to reduce the need for resources on review and modifications. So really just remember the goal, right? The takeaway, work with the parents, be aware of your resources, and use those to guide the path forward. And just remember, it's not about the name or the act that we do of a review and modification. It's about when relief can actually be provided. And so with that, I will turn it over to Kim.
Thanks, Paul. Can we go to the next slide, please? So in the LEAP program, we have a wide variety of incentives that we use to encourage parents to participate and to follow through with their participation in the LEAP program. One of the unique incentives that we offer here in Michigan is actually offered through our partnership with Michigan Works. And each of our Michigan Works regions provides financial incentives to our participants when they reach particular milestones. For example, in our Michigan Works Southwest region, participants receive financial payment when they complete orientation. They receive an incentive payment for completing certain pre-identified trainings, and they receive incentive payments upon obtaining employment, retaining employment for 30, 60, and 90 days. And we have no requirements around how they utilize those financial payments. So there was a lot of discussion in the planning phases around whether or not we would require that payment to be put towards their child support order. We decided against that. And we have found that there are a number of participants that do put their payment towards their child support order, but they also are putting those payments towards things that help them obtain and retain employment. For example, we recently had somebody that utilized their financial incentive payment to go to the eye doctor so that they could pass a vision screening that they needed to get their forklift license. So while they're not always putting the payment directly towards their child support payment, we find that most of the time they are putting their payment towards something that will help them be successful in obtaining and retaining employment and eventually making those child support payments in full and on time. Can you go to the next slide, please? So we make it a habit during our phone calls with our county partners and with our LEAP participants to talk about the variety of ways that parents are using our incentives, both financial and other supportive services, to be successful in the LEAP program. And this slide tells a couple of the stories. Some of the incentives that have been most successful for us have been the incentives that help people overcome barriers to employment, such as transportation and housing and criminal backgrounds. Helping people with transportation to and from training, helping people obtain their driver's license, helping people obtain the clothing and materials that they need to be successful in their job, have really, really helped people be successful in the LEAP program. And if you would like more information about the incentives that are offered in the various regions within Michigan, just let me know and I will be happy to share that information with you. And I believe that is all that we have.
Thank you, Michigan. Thanks for all that information. We're going to transition over to the state of Vermont. So Vermont, please go ahead and introduce yourself and take it away.
Hi, everyone. I'm Sarah Turcotte. I'm a program coordinator for the Office of Child Support in Vermont. And today we're going to go over the Work for Kids program that is stemmed out of the Office of Child Support. Next slide, please. So what is Work for Kids? So Work for Kids is a joint program by the Vermont Office of Child Support, Hireability Vermont, InvestEAP, the Vermont Judiciary, and the Vermont Association of Business, Industry, and Rehabilitation. So essentially, research indicates that the majority of individuals do not meet their child support obligations because they're not fully engaged in the workforce. Thus, they don't earn the money that they need to meet their obligations. And so Vermont is contracted. We pay them with sister agencies to provide wraparound services to non-custodial parents who are struggling to become or remain employed. This program was developed with the support and buy-in of the Vermont Judiciary. Next slide, please. So who does the project help? So obviously it's going to help the payors who are, trying to meet their obligations, individuals who are not employed or underemployed, facing, barriers such as employment, criminal record, mental health concerns, substance abuse. But the other component that we try to, message is our payees, who often become frustrated with the countless, oftentimes fruitless enforcement efforts that occur. And then obviously the financial stability of our children in Vermont. Next slide. And so the goal of the Work for Kids program is helping parents find and keeping good paying jobs so that they can meet their child support obligations. In this program, they gain work skills and knowledge, find a new or better job. They resolve issues that may be keeping them from, steady work, like the components I talked about in the previous slide, access support such as work clothes, transportation, training, and then they also have the ability to get personal counseling if they need it to stay employed. And at this time, I am going to pass this over to our director, Lisa Rivers.
Hi, everyone. Yes, my name is Lisa Rivers. I'm the interim director. Some of you might remember Robin Arnell, who just retired last month, so I'm temporarily stepping into her place. So thanks for having us. So I'm going to talk about how the Work for Kids program works. So OCS, as Sarah said, we are partnering with our other sister agencies, the ones that can really provide the resources to the non-custodial parents. So OCS would identify non-custodial parents who may benefit from the program and discuss the program options with them. As Erin had said, it's a voluntary program in their state. It is such in our state as well. Oftentimes, it becomes an involuntary program if the referral comes through the court. But when the non-custodial parent is identified as being a candidate for this program, there's a discussion both with the custodial and the non-custodial parents about the benefits of this program. And if the non-custodial parent is willing, then we would put it into an order and the magistrate would sign off on it. These referrals can come at the time of establishment or modification or enforcement. It doesn't really matter at what point in the process. We may have non-custodial parents who come to a case management conference and indicate that they don't have, the ability to work, or they have certain barriers, and that's where the conversation can begin. Or it could happen at the time of an enforcement action, and where it's a little bit, the pressure's on a little bit more. So the non-custodial parent then is referred to a counselor who explains the process and begins to forge the relationship and get services in place for the non-custodial parent. The counselor will conduct an assessment to identify any of the challenges and also the strengths of the party. They discuss potential barriers to employment, which may include such things as mental health, substance abuse, those kinds of things. The counselor would then assist the non-custodial parent in accessing resources and coming up with a plan for getting to employment. So we've found that well over 95% of the non-custodial parents that we're serving have some sort of disability. And sometimes it's just a referral to an agency that can help them fill out Social Security Administration documents so that maybe some Social Security disability benefits are in place, and then the children are going to benefit from the dependency benefits that come to the custodial parent. So we have developed a database with our sister agencies, which allows for information sharing. That's been really critical. The participants sign a release when they meet with the counselor, so they understand that some, not all, of the information that they're sharing with their counselor will be relayed not only to the court, but also to the custodial parent. That was critical for buy-in and from the custodial parent's perspective. And I'll talk about that in a little bit. But what happens in the database is the counselor and then the other sister agencies that we're dealing with will enter what's going on in the case. Is the non-custodial parent compliant? What is the plan of action? What are the barriers? So then if there's a question from the custodial parent as to whether the non-custodial parent is participating, we're able to get into the database and explain that as well. If the non-custodial parent becomes non-compliant, he or she doesn't attend meetings, or if they're just non-compliant in the program, that's also reported in the database. And at that point, the Office of Child Support could ask the court for a hearing, and we'd go back to court on the underlying motion, whether it's establishment, modification, or enforcement. Next slide, please. So this program is in every, I know that's hard to see, so I'll explain some of what you're looking at. It's more of the trends. But this program is in every county in our state. We began the program with just a few counties, but we have expanded to every state. The non-custodial parent can sign up for the county, which is closest to where they live, wherever is most convenient for them. We do keep data on the number of referrals. And what you'll see in this slide is in 2020, of course, with the pandemic, we had a big dip. That's what you'll see on the left-hand side. And then actually, even before the courts started opening up and we were able to go back to court fully, we were able to do some of these referrals and try to help them find employment as the pandemic started moving along in the process. So we've had a recommitment really to the program in the last couple of years, and we are really thrilled with the numbers that we're seeing. It's really been effective. Next slide, please. So since 2016, we've had over 1,000 participants, non-custodial parents participate in the program. We're averaging about 80 to 90 per year. And what we found is that's resulting in the non-custodial parent paying approximately 7 times more than they had been paying before the referral to the program. And that's 6 months down the road. So we're seeing that, you know, they're getting jobs, they're making payments, and they're keeping employment. Next slide, please. So as I said, we're in every county in the state. We weren't always offered in every county. We started as a pilot, but gradually we're in all 14 counties. Sometimes the referrals can occur without court involvement, and that's evolved as well. We started the program where it had to be a court order. It needed to be with a motion, some sort of motion having been filed with a court. But now we're able to, if a caseworker is working with the parties, and we don't have to wait for them to get to court. Oftentimes we are filing something along with it. Could be a modification, could be, usually in those cases, it's a modification if the non-custodial parent is coming to us. But we can talk with them about the benefits of the program and get it rolling even before we file with the court. So some of the challenges that we've had was custodial parent buy-in. And one of the reasons for the challenge was that we would go to court on an enforcement action and we talk to this non-custodial parent about services that can be provided to them. And the custodial parent is, I'm here for an enforcement. I want to get my money. And now you're talking about providing services that's going to mean it's going to be a little bit down the road before I get my payments. But what we found was it was actually the custodial parents who were feeling like there's a light at the end of the tunnel, that this isn't just this merry-go-round that they're on. We're coming back to court with nothing really coming of it. So over time, we've been able to show data to the custodial parents even that help with buy-in for them. We had to determine what was success. And while this is an employment program and that's the end goal, sometimes success is in assisting the parties in obtaining other benefits, such as the Social Security benefits that I mentioned earlier. Sometimes success is in the non-custodial parent receiving the substance abuse or mental health counseling they need that ultimately does result in employment, but oftentimes it's also a benefit to the family in other ways. Sometimes it's a downward modification of an order. Sometimes success is helping the non-custodial parent finding employment on his or her own as to avoid the program, because there are requirements of this program. Sometimes we get to court and they'd say, no, I'm good. I'll start work next week. And this was an impetus to get them to find the employment on their own. We had different missions from our partners, right? The counselors were in the business of providing counseling, and we really had to have some difficult conversations with our partners about our business and their business. We had many conversations sharing each other's missions and values. We had to find common ground on how they could do their work in supporting the non-custodial parent while also holding him or her accountable. And oftentimes they were reporting what they deemed to be confidential information to us, which was then shared with the court. and became public record. So we had some things we had to work through with our sister agencies in that way. We also had to have staff buy-in. Like the counselors, our staff sometimes didn't feel like this program was as effective because we were running up against some of those barriers with our partners. But as we worked through those and the results started getting better, there's been a whole lot of buy-in. What really was a big changing point for that with our staff is when we took it from being at the high level, let's plan this program, down to the local level, where our caseworkers and our paralegals were working with the local counselors, and they have now either bi-monthly or quarterly meetings, and they discuss cases in particular. So it really was relationship building. They could talk about cases, and that really, really went a long way. Next slide, please. And Sarah, I'll turn this back to you for some testimonials.
Yeah, so Director Rivers just was talking a little bit about the quarterly meetings. We also have an overarching monthly meeting, which is encompassed of some of our POCs at our localities, as well as some of the stakeholders in our sister agencies. And so as a result, we're always able to, talk about some opportunities as far as database improvements or just, program functionality. So that was a really good space to have. A couple testimonials that I'm going to share as a result of us meeting and everyone sharing their experience. This is actually shared from one of our sister agency staff. So essentially, there was an NCP that was referred just recently in April with 3 children that are over the age of 18, but she is in arrears. The barriers included, a criminal offense, lack of transportation, mental health. There was some previous employment, but she first started working with, oh, I'm so sorry. It had to be me. UPS had to come when I presented. I had prayed all day. But essentially, she was able to work with labor and hireability to support getting dentures, a haircut, mental health services, brainstorming housing and transportation, and stabilizing down the line. Late last month, she was hired part-time, which is a huge success. And the plan is to help this individual receive full-time employment closer in Middlebury so that transportation isn't as much as a barrier. And then the next slide for the next testimonial without my dogs barking, hopefully. Great for recording. Referred an NCP, did not have stable housing, had some medical issues and health insurance. This person has, essentially been in the Work for Kids program several times with multiple re-referrals. And essentially what happened is, a lot of vehicle transportation issues. So the program has helped him with tokens for the bus. Every time that he was having issues with transportation, we were able to find new employment, assist him with a purchase of steel-toed work boots. He was just paying until his job ended, and then he recontacted us to be involved again so that he can continue on with his payments. We also, we don't have a slide for this, but there was recently an NCP that turned CP through Work for Kids. They gained employment, really stabilized a lot of factors within their life, and were able to, take on more custody of their children and kind of we call it a flip case or mirror. And so those are a couple testimonials, and I will now mute myself so no one has to hear my dogs. I apologize.
Thank you, Vermont. Thank you, Sarah's dog. And we're going to go ahead and turn it over to Wyoming to talk about how they've enhanced their services, and then we'll have some time for questions afterward. And I love those success stories. Christy, Wyoming, you want to go ahead and take it away, please?
Sure. Thank you, Chad. And thanks everybody who's here today. And it's nice to follow some other amazing states. Some notes I've already jotted down and talked to Janelle about while we're sitting here from Michigan and Vermont. So We are constantly learning as we do this. Janelle Bergner is here with me today. My name is Christy Arneson. I'm the Wyoming 4D Director. Janelle Bergner is a project manager here in the state of Wyoming, and she's also the lead for Wyoming's Employment Services Program. And you could go to the next slide. So Wyoming's, our program is called Work Initiative Network, also known as WIN, and we selected this name via a competition, so that is fun. So just a few things over kind of high level stuff just related to the program so you have an understanding, and then we'll get into some of those enhanced services that Chad's talked about. So without reading it for you, you can see the goal of the program, which is very similar to everybody else's goal. It's really around ensuring that parents who owe support can have some type of secure and stable employment, not just receive that employment, but maintain that employment with the ultimate goal of being able to provide that consistent support to their children and families. So we have 23 counties here in Wyoming. We're currently operating either fully or in a pilot phase in 10 of those counties. We launched our program in January of 2020, so right before COVID hit. And we spent quite a bit of time when we launched. It wasn't launching with referrals at that time. We actually didn't start doing referrals in the program until October of 2020. We spent quite a bit of time. You'll see on there we have some partnerships, much as these other states do. We couldn't do this alone. So we partner with our Department of Workforce Services, and then we also partner with a private vendor whose name is Practice. So part of a lot of that time that was spent from January to October was really around doing nailing down policies and processes, because as they stated in Vermont, it is, as Lisa had stated, it's difficult when you're working with other partners who may not have the exact same goals or priorities as you, and really trying to ensure that you're able to get what you want and expect for the families and the parents that are going to come into your program. So we have, as you'll see here, so we started with, I believe 3, might have been 4 pilot sites. We've just expanded into others. And our goal, much like Vermont is right now, our goal is to get statewide. We had an initial goal of trying to get statewide by the end of this year, but I don't know that that will happen, but we are moving pretty quickly. So just a few things when we talk about partnerships, Wyoming Department of Workforce Services, we have an MOU because they're also a state agency. We pay them to do many of the things that you heard from Michigan and Vermont, right? They do expectations around job readiness, job training, some of those support services that I know Aaron went into quite a bit, and even they talked about within Vermont. So if it's work clothes or transportation or anything along those lines to ensure and help that person get employment and then maintain that employment. Also within that MOU, we have outcomes. We have some very specific outcomes related to what we expect when they leave the program. We have one, for example, we have what we'd like to see is 50% of the participants who have exited from the program have obtained an unsubsidized employment. And then we also want to ensure we have it at a 60% of the participants who have entered the unsubsidized employment retain employment for at least 6 months, and then measuring at that 6-month mark or through that time frame how their payments of child support are going. So some very specific measurements that we have with the Department of Workforce Services. One way we're able to track that, and we're working to enhance this now, is we actually, and we pay for this, the child support program pays for this. We have a shared module for the WIN program. It is built on top of the Department of Workforce Services larger system that they currently use. So it's very specific for WIN. Department of Workforce Services utilizes it. We have transparency and access into it. And it really is, and Lisa talks about their database, so it sounds very similar. So it's a system that we both are able to work within so that we can ensure that everybody has the information that's necessary. The hope eventually is that we can have referrals become automated. They're not automated today. And then one of the other things is that we want to ensure that we can have really good reporting because while we know it's a good program, we know we see good results, we also want to ensure we can have the data and also track the things that we want to be able to track within that system. Another big piece that we have that's part of that MOU is we do require the Department of Workforce Services to co-enroll our WIN participants. So they are required to co-enroll when appropriate those WIN participants into WIOA or vocational rehab, which we find really, really beneficial because a lot of times those parents are going to benefit from these other programs the department is already pursuing and experts in. So practice is interesting and very unique, and we're super excited to be partnering with them. What they are is they are a private entity, and they really focus on case management and skill development, which is focusing on parents and families who are typically in poverty and are very barriered populations. It's really about bringing practice in to integrate Department of Workforce Services with the child support program, because we do know we know the Department of Workforce Services are experts in what they do. But what we have found, at least here in Wyoming, is they don't necessarily work with the same type of populations that we typically do within the child support program. A lot of times people aren't walking in their doors with as barriered lives as we see. And what we wanted to ensure is that all the case managers, because what happens in our current program is when a WIN participant comes into the program, and I should mention they can voluntarily come in or they can come in through contempt by court order. But when they do come into the program, they get one case manager on the child support side and they get one case manager on the workforce services side who will work together with that participant. They will meet as a team, they will get attention from both of those, and then both those partners work together to figure out what is best for this participant, because as we've already discussed, it is going to vary, which is why these enhanced services are very important. It's going to vary participant to participant and is not a cookie cutter deal for people as they move through the program. So practice comes in as kind of a neutral third party, really works with, provides very intensive case management training to all staff at the same time, workforce services and child support. And that is all the way from the person that's doing the work on the ground, the case manager, to our supervisors and those that are supervising within those offices, onto the attorneys that work within those areas, because we have found that having the attorneys involved at that level has become very beneficial. And so again, like I said, one of the biggest things we're doing here is really trying to do an integrated approach so that we can target these barriered populations. And as you'll see on that slide, what we've seen so far, I mean, at one point it was as high as 20%, but what we're seeing an average of is as these participants work through the program, we are seeing within those cases a 12% increase in current support, which is obviously something we're excited about. You can go ahead and go to the next slide. And Janelle, before I go into these, is there anything else you'd like to add with regards to the overview that I may have missed?
Nope, I don't think so. It sounds great, Christy.
Great, thanks, Janelle. So as you'll see on here, we have very similar enhanced services that you saw from Michigan and Vermont. One that might be a little bit different that I just talked about, and it should actually say dedicated child support and workforce services case manager. And while it's not necessarily in an incentive like the others that are listed on here, what we find and what I just spoke about is the integration between workforce services and for us and them having a dedicated case manager on both sides who is really there to work for them and really say, how do we help you parent do what is the goal of this, right? Which is obtain and maintain that that employment so that they can continue to make their child support payments on a consistent basis. And so they do get that tailored approach, they do get that focus, they do get that attention. And they also have two case managers that are working together. So those case managers are in the know, right? It's not just the parent working with one and then the other, and then there's no connection back to each other. So that really we have seen as the program, even though it's still pretty new, we have seen that that is a huge benefit to the participants. So a few other things. So state enforcement, very similar to the others. What we have under those, right? We'll reinstate anyone that has a driver's license, suspended that needs it. We'll hold off on suspending driver's license. A big one in Wyoming, that's not so much in other states, is game and fish. So hunting licenses. That's a really large one. So again, we'll do state enforcement with regards to those suspensions, order to show causes, bench warrants, and credit bureau reporting are the big ones within Wyoming when we talk about state enforcement actions. And we do know, right, the whole point is we want them to be successful. So giving them the ability to not have to worry about these enforcement actions carrying forward as they go through the program does give them that sense of relief and the ability to really think that they want to be able to do this program and know that they potentially can be successful in it. Janelle, anything you want to add? Janelle does this on a day-to-day basis. She's really in the trenches on this, works with our staff and works with participants. So is there anything specific, Janelle, you think that's important for those on the call today to hear on these?
I think in all my years of child support, I think that the greatest asset to our non-custodial parents right now are those dedicated case managers, because while we've always projected good customer service and what can we do to help you, this is the program where they really feel like we are helping. Like this is specific to them, giving them a tool that will help them in all areas of life after today. So that's what I would add.
Great. And so just payment plan adjustments, this is something that we do on 100% of cases that come into the program. And essentially what it is, we look at what they have, and then they have to obviously be actively participating to receive this. Essentially, it's a graduated plan that gets set up with them, with their worker. Arrears are still going to accrue while they're in the WIN program, and we're really still trying to get payments to be made. This is a compromise, essentially a balance of wanting to assist the parent that's in the program that owes the child support, but also the parent that is, required to receive support. So it's really trying to work a balance. So we do a graduated plan. A certain amount is set for the first 3 months. And again, that's going to be very case specific. And then that's going to increase as depending on how long they're within the program and just their circumstances, it will potentially increase until they are out of the program. And Janelle, do you have anything that you want to add with regards to the payment plan? Just because I know that is one of the biggest ones that hits. Not all of these get used in every single case. For us, payment plan adjustments does get used in every single case.
I would say that when we first started, the first 3 months, we were working with our NCPs to just not to pay anything while we got them enrolled. And that just was not working from a custodial parent standpoint. And so we've adjusted that so that there's some kind of payment coming in those first 3 months. It's minimal, but it has really helped make everyone feel better about the program. So.
Great, thank you. So you saw this in other ones. Expedited modification is also something. We are a very judicial state here in Wyoming. We have a very few things we can do administratively. We're actually hopefully working towards some administrative abilities and authorities with regards to modifications. But with regards to these cases and expedited mods, because we're a judicial state, we have certain process we do have to follow, but I do think we typically, if they request a mod, we have some lessons learned on this one, but an interesting fact is only about 15% of the participants that have gone through WIN have actually wanted or requested a mod. I think we thought it would be higher, but most of them want to try to pay what they are owing. But when they do want mods, Janelle, correct me if I'm wrong, but I think we're typically getting those mods done for them in about 4 months.
Correct.
Just so you know that's kind of the time frame that we're working with the current processes that we have in place. So state debt arrears forgiveness. This is where what we will do is work with a participant, really kind of an incentive or a carrot, right, along the way at certain milestones along their journey within this program. Then we would work with them to identify, right, what are their arrears that are owed? And then along the way, what amount of arrears are we willing to forgive as they work and are becoming successful throughout the program? The interesting fact here is none of our participants at this point in time have any state arrears that are owed. So this is not an incentive that we've yet been able to utilize, but I think we still believe it is a very good incentive to have within our policies and within the tool belt, so that when we do receive participants that do owe state arrears, this is something that we can provide to them as an option. Before we run to the next slide, Janelle, anything you want to add? This is really kind of the bag of goods we have when we talk about enhanced services and incentives. And I think we're always looking right to other states or to other places that do things differently or have very similar incentives, but maybe operate them in a different way, because it is, for us, I say we're still new at this, we're still expanding and we're still learning. But Janelle, anything else you want to add with regards to these specific incentives that we offer?
Nope, I think you got it all, Christy.
Great. Okay, so we can go to the next slide. So lessons learned. So I think there's been, and I think Lisa shared a few of them that we have on our list as well, but some of them very specific to those incentives that you saw or those enhanced services, and then some are a little bit broader, but very specific to when we talk about a dedicated case manager or dedicated on both sides of the house. One thing, and I mentioned it briefly, that we've learned along the way, we've done a lot of trainings, we've done a lot of bringing the whole team together, and we really focused at that case manager level to begin with. And as we've added more sites, some sites have become more mature in doing this, and they've really created great relationships and processes. What we found is, I think in the beginning, we we kind of left the attorneys out of the mix. And so in Wyoming, and this may be beneficial for purposes of understanding how we're situated, right? And we're state administered, county run, but we have 9 judicial districts. And we have 5 of those judicial districts are run privately by Young Williams. And then the other 4 we have contracts with, we call them public districts. But as a whole, we operate as one team. So there's attorneys in each of those districts that are a part of this team. And so we've started including those attorneys in that training, in case management training, and that buried population training with workforce services and our child support staff that practice does for us. We've included them in the continued meetings that happen, right? There's training and then there's continued meetings throughout the year. There's different monthly meetings or bi-monthly meetings, quarterly meetings. And what we found, because attorneys play such a large role in this, somebody might want to voluntarily come into this program. And I think we were maybe a little overly optimistic when we rolled this program out. We really thought we were going to get so many people that were going to voluntarily opt in to win. We've had some, but not near the amount we thought we would. And so I would say, and Janelle, correct, if you disagree, please chime in, but I would say the majority of the cases that are coming in to win right now are coming in through a court order. We have some that are voluntary. We'd love to get more that are voluntary, but we're going to kind of work with what we have at this point. And so it's even more important that we have our attorneys at the table as part of this process and as part of that team working around this participant to ensure we can really provide them with whatever that best opportunity is for them to be successful. As I had mentioned with expedited mods, and maybe it's not a lesson learned, maybe it's just an interesting fact we've learned that I think maybe was not something we had anticipated, was I think we thought we would be doing more mods through this program than we have. Don't get me wrong, we've done our fair share and they're getting done quickly for them, but a lot of them either don't want a mod or maybe not eligible for a mod. But I think it's a little bit lower percentage than what we had thought. A few other things is when you look at enhanced services or these incentives or just your program as a whole, we have a lot of policies, we've pared those down. I'll tell you, when they spent however many months creating a policy manual, that policy manual was so massive. We then took a step back and said, we need to refine this. And so there's been a lot of work. And so I would say, don't be afraid to be flexible. Don't be afraid to be agile. So maybe you have enhanced services or incentives or just other pieces of your program that you think were going to be really great. And you get into the middle of it and you really realize that maybe they're not so great and you need to adjust. Or maybe there's things you didn't think about and now you want to think about them, or you think they might be beneficial for the program. And so I just say, allow yourselves, and if you're working with partners, encourage your partners to also be flexible and agile. And that's been, I'm going to go into the one that Lisa had mentioned. One of the lessons learned is it's hard when you work with partners. And I think we all know this, we do it all the time, but you think, right? I think there's been times when we're in really, really great places with the Department of Workforce Services. And then there's times when we kind of get off track and maybe kind of are going in different directions, and we have to be able to come back together and really kind of say, what's the goal? What are we wanting to achieve here? And really at the end of the day, it's wrapping ourselves around these people and these parents and ultimately, right, the family as a whole and these children that we want to be able to see be successful and live, right, an economically secure life. And that's helpful, but it's hard. And it's a constant conversation, and it's a constant revisiting of different things throughout, all the time, I would say daily almost. And it's really just working together and understanding that we have to do things within partnerships. And a few other things is just, and Janelle can attest to this one because she's more in the trenches on this, but tied into partnerships, but just in general, the process is hard. There's so many moving pieces and parts to, at least for us, to this employment services world, and to really ensuring and trying to find what is the most beneficial for each parent, again, because it's not exactly the same, and working together across agencies to do that, and just knowing it's not going to always be easy. It's not going to always just come together nicely, and that it is going to be hard, and we have to know that that's okay. And then we have to be able to just figure out how do we continue to move forward, understanding that at the end of the day, we are going to be able to hopefully provide some good benefit to these parents and ultimately get them in a really great place for their future. And then the other thing I would say is, right, lesson learned for me is I'm constantly learning every single day and I just learned today from Vermont and Michigan, which I think helps, which is why I think Knowledge Works is a really amazing thing. We, again, are so new to this, and there's other people that have been doing it for a long time, and just a lot of really smart people, not just within our program or our partners, but across the country that are doing this work. And I think we can just be, if we're willing to learn from others and then look at ourselves and say, how do we do better? I think at the end of the day, all we do is really just provide more opportunities and more benefit for, opportunities for success for these parents and these families. And I think that's ultimately what we're striving to do there. Janelle, anything, like I said, Janelle's in the trenches. So anything specific in the trenches that you would like to share on lessons learned, Janelle?
I don't think so. I think you covered it, but thank you for all of the information. This has been really helpful for us too, as we move forward to get the rest of Wyoming on board. So we appreciate the information.
Great. And Chad, that's all we have. That's the end of our slides. So thank you very much.
Great. Hey, thank you, Christy. Great job. Thanks to all of our presenters from Michigan, from Vermont, and from Wyoming. It's really great to hear how everybody is enhancing their services, trying to ensure that our enforcement remedies aren't becoming counterproductive for our parents and the overall goal of getting that support to the children. I really want to tease out something here and then see what other questions and I'm comfortable saying this with Christy on the phone. This is like, if one of our incomes changed today, we changed our budget today. And we know there's all the things, procedural due process, all these things involved, and, the Bradley Amendment, all those kinds of things that were called out. And you mentioned like a 4-month timeline, I believe, Christy, but really to try to get our families in the same situation as all of us, which is how do we allow them to change their budget today when their income changes today? So I really want to kind of call on Paul to really tease out for us. You did a great job explaining all the options, Paul, that are being leveraged there. But can you please kind of draw out and explain the timeline a little more detailed and how it would play out in Michigan? How long after somebody gets enrolled into that program, and then you guys, if you're following, I think it was your judicial process, you're providing notice and filing that action and trying to preserve a certain date for that relief to be able to go back to. So can you please tease out the timeline for us, Paul? And like after somebody gets enrolled and you guys take those actions, how, what date is being preserved for that relief to apply back to post-enrollment?
Yeah, sure, Chad. And I think this kind of ties into one of your opening comments about with Perora and how at a certain point in time, the process can turn into a barrier. And I think that kind of has played out as we look at reviewing support orders. So again, I think the starting point is just recognizing our normal process, and our normal process is what we just call a review and modification through the office. It's more of an administrative, even though it ends up as an order with the court. And that's where the 180-day Fed Reg timeframe comes into play. And so we've got the 6 months that, it can take, and we send out the questionnaires and we do all that. For this, and with the idea of kind of using the strength of the judicial approach, the idea is once we learn about something, it's great if the parties file a motion on their own, but we know that doesn't always happen. And, today we're talking about parents with employment issues. We've been looking at ACEs, adverse childhood experiences, and the impact that has on the caseload. And so we know that people with those experiences tend to struggle to take action proactively. And so once we learn about that, so let's say the referral comes in or the parent voluntarily, joins the program, our front of the court staff can file a motion with the court. And by filing a motion, we file it with the clerk of the court, that then gets sent copies to the parents. And if we have attorneys on record, it goes to them too. But that serving of that motion or that petition is potentially preserves, or it does preserve that effective date. And so let's say on October 1st, we learn that we have a parent who's entering the LEAP program in Michigan. The front of the court staff may learn of that on October 1st, and so they file a motion as quickly as they can, and then the service happens. So we're talking, if it gets prioritized and picked up, that filing of the motion and service can happen within, days or a week or so, as opposed to the back end with the rev mod process of 4 to 6 months out for review. So it's all about really getting that motion filed. That preserves the date, and then the court doesn't have to go back to that date, right? They could say, okay, things are kind of still up in the air, or we're happy with where we're at just moving forward. And so they could just use the date once the support is kind of calculated and the support recommendation is filed. But in these cases, like kind of you're addressing here, it gives us a chance to go back to that, early October date in my example. So I hope that answered your question.
That sure did. Thank you, Paul. I really appreciate that additional explanation of that time frame, because I really think you guys have gotten so close to what I'm talking about. Like when income changes, they have to be able to change their budget, not 4 months from now. So,
and we
once again, and go ahead.
I was just going to say,
Please.
We saw that really play out when COVID hit, right? And we had all of these offices kind of saying, wait, what can we do? Because there's a desire from everybody in the program that recognizes the need of the parents and the families. And so it really led us to kind of think through and uncover some of these thoughts, which ultimately we were able to use for this LEAP program as well.
Thank you. And we'll go into some other questions here. I saw the question coming in the chat about funding. And we had our first couple Knowledge Works webinars, and these are all recorded. If you go to the Office of Child Support Enforcement's website, you go to the Child Support Professionals tab, then the drop down of Working With, and then the drop down of Working With Employment Programs. And if you go to kind of the center of our top page, the Knowledge Works page, you'll see a link to previous recorded webinars. And you can review those. But the three ways for people, for any state to fund these programs is Section 1115 waiver application submitted to our office and receiving approval that way to spending money on something you normally couldn't, and receiving federal financial participation. We also have the incentive exemption process, which is also like up to 5 years. I believe you can request your incentive exemption or a Section 1115 waiver. So some states are funding it with incentives through an incentive exemption process with their office, some through Section 1115 waivers, and some through TANF funding. So those are the three main ways. And I think I saw Christy answer. Wyoming funds theirs with TANF now, Christy?
That's right, Chad. So we fully fund right now with TANF reserves and are exploring the option to the incentive exemption to braid in some child support incentive dollars into the funding as well.
Great, thank you. And Michigan is funding it with a Section 1115 waiver that they currently still have in place with our office. And Vermont, Lisa, how are you guys currently funding it out of those three options? I'm not sure where you're at, or you might be using state-only monies.
Currently state-only monies, we are looking into a waiver.
Thank you. Yes, so those are the three main ways. And you can find, more information about that on our website. Like I said, other strategies, or you can follow up. So thank you. Other questions in the chat, Tristan or Melissa? Looks like we got all of them from the chat that I'm seeing so far. How about from the audience? Does anyone have any questions for our presenters? We still have enough time to take a few questions. Any questions out there? I'm going to ask one more time. Tristan, are you able to see if any questions have come in the transcripts, or anyone want to ask a question before we leave our presenters go?
I have not seen any hands raised, so I think you covered everything in the chat.
Okay, great. Well, this concludes our 6th KnowledgeWorks webinar, Enhanced Child Support Services for Non-Custodial Parents Seeking Employment. Please watch for our next KnowledgeWorks webinar, which will be specifically about marketing, outreach, and enrollment strategies for non-custodial parents and for the community and the partners. We'll look forward to seeing you then, and thank you again to all of our presenters. Thank you everyone for taking your time out to join today. Have a nice afternoon.
Thanks, everybody. Thank you.